Assalamu alaikum warahmatullahi wabarakatuh. Today in this video I'm going to debunk one of the biggest misbeliefs that type 2 diabetes is chronic, progressive and irreversible, which is absolutely not true. Without further ado, let's go to my computer to better understanding through illustration. It is because of type 2 diabetes people treated under the wrong treatment paradigm. They focus only on lowering high blood glucose from the blood instead of concentrating on reducing insulin resistance, which is the real big problem of all type 2 diabetes. The current treatment system is thinking that type 2 diabetes people do not produce insulin, so they need to inject insulin externally, which is utterly wrong because type 2 diabetes people do produce insulin, but due to some wrong food choice and lifestyle, that insulin cannot work properly or are not allowed to work by the cell, where type 1 diabetes people do not produce insulin at all, and that's why they need to inject insulin externally. A fundamentally wrong approach to treat type 2 diabetes people, and that's why with the current type 2 diabetes treatment paradigm, people are getting more and more sicker than to recover. According to the new American College of Physicians Guidance Statement number 1 and the famous ECHO trial. Now, if type 2 diabetes is a chronic, progressive and irreversible, then how come people who undergo bariatric or gastric banding surgery and reduce insulin resistance in 12 weeks and recover from type 2 diabetes? Let's see how. Bariatric surgery helps reduce insulin resistance in 12 weeks and recover from type 2 diabetes. Bariatric surgery work by changing the anatomy of your stomach and the digestive system, as you can see in the picture by the red and black arrow, to help you lose weight, improve your energy balance and fat metabolism. But due to progressive abdominal pain within the first few weeks after the surgery could be caused by a slow leak or perforation. This type of leaks require emergency admission to the hospital. In some cases, urgent surgery is needed. Therefore, people do not like it. Another surgery called gastric banding also helps reduce insulin resistance in 12 weeks duration. Hence, recover from type 2 diabetes. This surgery involves placing an adjustable silicone gastric band around the upper part of the stomach, as you can see in the picture indicating by the long red arrow, to decrease stomach size and reduce food intake to improve energy balance and fat metabolism. The band creates a small stomach pouch above it with the rest of the stomach below. The procedure constricts the stomach so the person feels full after eating less food than usual. But due to a maladaptive eating behavior is a common cause of abdominal pain in the early post-operative period, gastric bypass alters satiety and the patient may not perceive fullness until pouch distension to the point of pain. Therefore, people do not like it too. Now, instead of surgery, some people choose to use drugs to achieve the same results. And with the side effects of these drugs, people still reduce insulin resistance in 12 weeks and recover from type 2 diabetes. Let's see how it works. Drug acarbose helps reduce insulin resistance in 12 weeks of using it, and in the process, people recover from type 2 diabetes if someone continues utilizing this drug. This drug works by slowing the action of certain chemicals that breaks down food to release glucose into your blood, as you can see on the right side of the picture, where metformin works by releasing the amount of glucose your liver releases into your blood to prevent the rise of the glucose level in the blood, which is the left side of this picture. But there are many side effects of this drug, which are allergic reaction, severe itching, severe stomach pain, severe constipation, watery or bloody diarrhea, etc. That's why people do not like this drug. Another drug called SGLT2 protein inhibitor also reduces insulin resistance using 12 weeks period. SGLT means sodium glucose cotransporter protein. There are two proteins, sodium glucose cotransporter number 1 protein and sodium glucose cotransporter number 2 protein. We will learn about SGLT2 protein here. So the function of the SGLT2 protein is to reabsorb the glucose from the kidney and back into the bloodstream. This SGLT2 protein inhibitor works by preventing the protein from reabsorbing the glucose from the kidney. It blocks those proteins, as you can see the red upward arrows in the picture, which means less glucose gets reabsorbed back into the blood and more gets passed out of the body via the urine. Thus, by reducing the glucose from the blood helps to reduce insulin resistance in 12 weeks period of using these drugs. Hence, people recover from type 2 diabetes, but there are many side effects of this drug. which are genital yeast infection in men and women, urinary tract infection, increased urination, kidney problems, constipation, etc. That's why people do not like this drug either. Fasting protocol, which is the natural alternative of surgeries and drugs mentioned above, also promote blood glucose control by reducing insulin resistance in less than 12 weeks without significant side effects. Hence, people recover from type 2 diabetes faster than above 4 methods if they continue with the right diet and the right amount. Because if the person fasting for certain hours, but when they break the fast with the wrong types of food, then the whole purpose of fasting is ruined. Now, if bariatric surgery, gastric banding, drug acarbose, drug SGLT2 protein inhibitor, and fasting protocol can reduce insulin resistance in 12 weeks period and recover from type 2 diabetes, then where did the idea come from that type 2 diabetes is a chronic, progressive, and irreversible? It is because the current protocol focuses only on lowering high blood glucose from the blood using medicine or insulin. Instead, focus on reducing insulin resistance, which is the real big problem of all type 2 diabetes and often overlooked. Now, if you have a fever due to virus or bacterial infection, and instead of treating the infection with an antibody, if you take a Tylenol or Advil just to treat the fever, your fever may become lower in terms of temperature and you may feel better for a short term, but your infection is becoming worse as time goes by. The same things happening with type 2 diabetes. Our current protocol is only targeting to lower the high blood glucose by medicine or insulin. For the time being, maybe the glucose level from the blood gets lower, but the real problem is insulin resistance becoming worse as time goes by. Then more and more insulin needed to lower the same glucose level, and the patient's condition and the insulin resistance become even worse, according to the new American College of Physicians guidance statement number 1 and famous ACCORD trial. The last thing you will do to give more alcohol to an alcoholic or to give more drugs to a drug abuser, if you do care for that person or if you are a real well-wisher. Due to this fundamental shift in the treatment of type 2 diabetes, people are not getting well, even after 10, 20 or 30 years of taking medicine or insulin.
Imagine your body as a big sugar container. At birth, the container is empty. Over 3 to 4 decades, you eat sugar and refined carbohydrates, and the container gradually fills up. When you eat next, sugar comes in and it spills over the sides of the container because the container is already full. The same situation exists in your body. When you eat sugar and or high carbohydrate diet, your body releases the hormone insulin to help move the sugar into your cells where it used for energy. If you don't burn off that sugar sufficiently, then over 3 to 4 decades, your cells become completely filled and cannot handle anymore. The next time when you eat sugar and or high carbohydrate diet, insulin cannot force it anymore of it into your overflowing cells. So it spills out into the blood. Sugar travels in your blood in a form called glucose, and having too much of it, known as high blood glucose, is a primary symptom of type 2 diabetes. When there is too much glucose in the blood, insulin does not appear to be doing its usual job of moving the sugar into the cells. Then we say that the body has become insulin resistant, but it's not truly insulin's fault. The primary problem is that the cells are overflowing with glucose. The high blood glucose is only part of the issue. Not only there is too much glucose in the blood, but also there is too much glucose in all the cells of the body. Type 2 diabetes is simply an overflow situation that occurs when there is too much glucose in the whole body. In response to excess glucose in the blood, the body releases even more insulin to overcome this resistance. This forces more glucose into the overflowing cells to keep the blood levels normal. This works, but the effect is only temporary because it has not addressed the problem of excess sugar. It has only moved the excess sugar from the blood to the cells, making insulin resistance even worse. At some point, even with more insulin, the body cannot force any more glucose into the cells. Think about packing a piece of luggage. At first, the clothes go into the empty luggage without any trouble. Once the luggage is full, however, it becomes difficult to jam in those last 2 t-shirts. You reach to a point where you can't close the luggage. You could say the luggage appears to be resisting the clothes. This is similar to the overflow situation we see in our cells. Once that luggage is full, you might simply use more force to shove those last t-shirts. This strategy will work temporarily because you have not addressed the underlying problem of the overfilled luggage. As you force more t-shirts into the luggage, the problem only becomes worse. The better solution is to remove some of the clothes from the luggage. What happens in the body if you do not remove the excess glucose? First, the body keeps increasing the amount of insulin it produces to try to force more glucose into the cells, but this only creates more insulin resistance, then becomes a vicious cycle. When the insulin levels can no longer keep pace with the rising resistance, blood glucose spikes. That's when your doctor is likely to diagnose type 2 diabetes. Your doctor may prescribe a medication such as insulin injections or perhaps a drug called metformin to lower blood glucose. But these drugs do not get rid of the body of excess glucose. Instead, they continue to take the glucose out of the blood and cramps it back into the body. Then it shipped out to other organs such as the kidneys, the nerves, the eyes, and the heart, where it can eventually create additional problems. The underlying problem is still unchanged. Remember the container that was overflowing with sugar? It is still overflowing. Insulin has moved the glucose from the blood, where you can see, into the body where you cannot see. So the very next time you eat, sugar spills out into the blood again, and you inject insulin to cram it into your body. Whether you think it as like a piece of overstuffed luggage or an overflowing container, it is the same situation all over again. The more glucose you force your body to accept, the more insulin your body needs to overcome the resistance to it. But this insulin only creates more resistance as the cells become more and more expanded. Once you have exceeded what your body can produce naturally, medications can take over. At first, you need only a single medication, but eventually it becomes 2 and then 3, and the doses become larger. And here is the thing, if you are taking more and more medications to keep your blood glucose at the same level, your diabetes is getting worse. The blood glucose got better with insulin, but the diabetes got worse. The medications only hit the blood glucose by cramming it into the cells, which is already bloated. The diabetes looks better in terms of blood glucose level in the glucometer, but actually it is worse in the whole body. Doctors may congratulate themselves on the illusion of a job well done. Even the patients get sicker. No amount of medication prevents the heart attacks, congestive heart failure, strokes, kidney failure, amputations, and blindness that result when diabetes is getting worse. Then they say, oh, it's a chronic and progressive disease. But it was not. Here is an example. Consider that hiding garbage under your bed instead of throwing it out allows you to pretend that your kitchen is clean. When there is no more room under the bed, you can throw the garbage under the rug, then in the basement, in the closet, even in the bathroom. But if you keep hiding your garbage, eventually it is going to smell bad because it's starting to rot. Instead of hiding it, you need to throw it out. If the solution to your overflowing luggage and your overflowing house seems obvious, the resolution of too much glucose, which leads to too much insulin, should also be similar. Get rid out of it. But the standard treatment for type 2 diabetes follows the same wrong logic of hiding the glucose instead of getting rid out of it. If you understand that too much glucose in the blood is toxic, too much glucose in the body is also toxic. What happens when excessive glucose piles up in the body over 10, 20 or 30 years? Every cell in the body starts to rot, which is precisely why type 2 diabetes affects every single organ of the body. Your eyes rot and you go blind. Your kidneys rot and you need dialysis. Your heart rots and you get heart attack and heart failure. Your brain rots and you get Alzheimer's disease. Your liver rots and you get fatty liver and liver cirrhosis. Your legs rot and you get diabetes foot ulcer and eventually amputation. Your nerves rot and you get diabetic neuropathy. No part of your body is free from being rot. That's why the scientific community named type 2 diabetes is the mother of all diseases. Standard medications do not prevent the progression of organ failure because they do not help eliminate the toxic sugar load from the body. More than 7 multinational, multi-center, randomized, and placebo-controlled trials have proved that standard medications that lower blood glucose does not reduce heart diseases, the major killer of type 2 diabetes patients. According to a famous Canadian nephrologist, Dr. Jason Fang, you have pretended that those glucose-lowering medications make you healthier, but it's been a lie. You have overlooked a singular truth that you can't use drugs to cure a dietary issue. As well as once Dr. Werner Wheelock said, if I had a flood in my house, I would not spend day after day week after week or year after year to buying buckets, mops, and towels. I would not be inventing different types of buckets and more expensive mops or drainage systems to ensure the water drained away quickly. Instead, I would find the source of the water and turn it off.
Moreover, I would like to conclude this by Dr. Sarah Hallberg's eye-opening presentation in 2015 at a TEDx event at Purdue University, Indiana, United States, which accounted for over 5 million views on YouTube and is still growing, where she said reversing type 2 diabetes starts with ignoring the guidelines. There you know now that type 2 diabetes is entirely reversible, not progressive and not chronic, and this education is being hidden from people with type 2 diabetes for some obvious reason. The longer you hold this misbelief, the longer you will be sick. The longer you keep type 2 diabetes under maintenance, the more maintenance cost will be as time goes by and your health deteriorates substantially. And you possibly could lose your vital organs like eyes, kidneys, or even health over time. So click the link below to see if you qualify, then book your pitch-free call to find out your best personalized meal to master type 2 diabetes through nutrition. Thank you, and I look forward to helping you out of this.